Bridge, New Frontiers in Type 1 Diabetes.
It might be that Rosa, and particularly her parents, but Rosa herself might say, well, maybe I'll participate in a big screening initiative. And what will be done then in Rosa's blood, they will look for specific autoantigens. We have 4 different antibodies that we are looking at: IA2, IAA, zinc transporter, and GAD. Now, if you have only 2 of those, at least 2 of those, this is the early diagnosis of type 1 diabetes, because your long-term risk is 100%. We don't know exactly when it's going to happen, but yes, type 1 diabetes will happen. The interesting part is that if we look at the timing at these antibodies, in 80% of those who develop type 1 diabetes in their adolescent, young adult age are already happening very early on. So 80% of children who develop clinical type 1 diabetes by adolescence will be antibody positive at age 2. So we really have a big window of opportunity if, for example, we have a screening program together with the immunizations. Yes, 80% is not 100%, so yes, we want to, of course, maybe capture everyone, so you can consider to have a second screening between 6 to 8 years. Those are the details that we need to discuss. But clearly the islet cell antibody, the seroconversion peaks between age 9 months and 2 years of age. So in Rosa's case, she tests positive for GAD and IA2 antibodies. So she will be checked and will be confirmed with a second independent sample. And then depending what it is, whether she's single autoantibody positive, we will still follow up her. We will provide education. We will provide psychological assessment and support. And of course, if she is then diagnosed with early type 1 diabetes, we will commence with metabolic monitoring, both at home as well as in the lab, and then also make sure that she doesn't end up with a DKA.
Bridge, New Frontiers in Type 1 Diabetes.